So far in this class we've talked about various kinds of psychological disorders that a person might have. But we haven't talked about this last category, and that is personality disorders. We talked about personality earlier in this semester as being your characteristic way of thinking, feeling, and acting. But what if the very heart of who you are, your characteristic way of thinking, feeling, and acting, is in some way disordered? Can you imagine a situation in which a person's personality may get in the way of their functioning, or cause distress, or be consistently deviant? If so, what you're imagining is a personality disorder. Next slide. Here's a question for consideration. Do you think it is possible for a person to have absolutely no conscience, to feel no compassion for others, and feel no guilt when they hurt others? Why or why not? So just take a moment to write down your answer to this question before you go on to the next slide. Partially in answer to the question whether someone can have no conscience, what let's do is look now at a profile of a fellow by the name of Richard Allen Davis, who, as far as I know, is on death row in California. Richard Allen Davis was born in 1954, and he's currently in jail for the murder of a 12-year-old, Polly Klaas. But let me tell you a little bit about his history. He was arrested in 1967 when he was 13 years old for indecent exposure, and also at age 13 arrested for burglary and forgery. Age 15 arrested for burglary. Age 16 arrested for theft. 19 years old was a big year for him. Drunk in public, resisting arrest, underage drinking, burglary, trespassing. Between ages 20 and 22, burglary. He was shot, violated probation, committed car theft, arrested for drug possession, arrested for kidnapping, sexual assault, made a suicide attempt, and escaped from prison. At age 30, arrested for armed robbery and kidnapping. Ages 39 through 52, driving while intoxicated, violating parole, assault, murder, robbery, burglary, kidnapping, and lewd act upon a child. Currently an inmate in San Quentin State Prison, and also drug overdose there in San Quentin. Not a very nice fella. In one of his trials, the judge asked him, "Do you feel bad about what you've done?" And Davis's response was, "If I felt bad about it, I wouldn't have done it." The judge says, "It doesn't bother you at all?" Davis' response was, "If it did, I wouldn't have done it." Complete disregard for other people's well-being, a seemingly complete lack of conscience on the part of Richard Allen Davis. He's an excellent example of what we might call antisocial personality disorder. So as we begin personality disorders, we're going to use antisocial personality disorder to illustrate. Go on to the next slide. Antisocial personality disorder is a condition in which the person has very little conscience or a lack of conscience. When we see people like this in society, sometimes we call them psychopaths or sociopaths. As you can see from the bottom right, there's that face of Ted Bundy again. Ted Bundy being a person who clearly was a person that would be considered to have sociopathic tendencies, a serial killer, rapist, murderer. Antisocial personality disorder is something that shows up early on in life. Now, Richard Allen Davis didn't get himself in trouble until age 13, or at least that's his first history of arrest. But typically, people who end up with antisocial personality disorder have an earlier version of this called conduct disorder in childhood. And they do all kinds of things that are hurtful to other people and show early symptoms of no conscience whatsoever. So, for example, even by 6 and 7 years old, you may see things like poor grades, disobedience, stealing small things from home, setting fires, Davis caught and cut up dogs as entertainment when he was a kid. So you can see that this is something that's going on from a pretty early age. Of course, it becomes more severe with time as the child develops mentally and physically and can do more things. So the child may graduate from stealing silverware and pawning it to stealing car stereos or even to stealing cars. It's not uncommon by the time they reach adulthood for men like this to have been in jail 50 or more times, or maybe even be bailed out 100 or more times. Of course, antisocial personality disorder, because it's the personality, is going to affect all areas of the person's life, whether it's male or female. By the way, we see a lot more of this in males than we do in females. With males, though, the behaviors are usually more extreme, like fighting, stealing, and vandalizing. Females are more likely to see behaviors like lying, running away from home, and prostitution. But the disorder affects all areas of the person's life. So you can imagine, think about their work. Work is going to be unstable, have difficulty keeping a job. Education, they may not complete their education, may drop out of school early. The relationships may be very unstable. They tend to be manipulative. They tend towards violence, tend towards substance abuse. So all areas of their life are likely to be affected. Unfortunately, people with antisocial personality disorder can also be quite intelligent, charming, and funny. That is, they can really find a way to make you think that they're okay as they're stabbing you in the back or as they're taking advantage of you. You might want to take a look at the video called Mind of a Psychopath that is available in the Moodle for this class segment. One final thing to keep in mind about antisocial personality disorder is that the brain scans of these men tend to show underactivity in the fear and judgment areas, the parts of the brain responsible for having fear of others and for using good judgment. You'll see that in the video called Mind of a Psychopath. You'll also see it in a review of a study that we're going to talk about in just a minute. Next slide. In one study of antisocial personality disorder, people with antisocial disorder and people without that disorder were shown a series of slides while their brain was being evaluated using brain scan techniques. And what was found was that in slides like this, you can see the savage dog attack slide. In slides like this, both antisocial personality disorder people and people without the disorder reported experiencing fear when they saw this slide, when they saw these scary sorts of slides. But let's go on and see what happened. Go on to the next slide and see what happened. Next slide. Here you have the brain scans. On the left you have a person without antisocial personality disorder, and on the right you have a person with antisocial personality disorder. Keep in mind that the yellow and the red parts are the more active parts of the brain shown by this MRI. What do you see as the big difference? The major difference lies in the frontal part of the brain. On the left side, in a normal person, you can see that in response to the frightening stimuli, you've got activity occurring in the frontal part of the brain, the part of the brain responsible for fear and good judgment. In the antisocial person on the right-hand side, you don't have hardly any reaction at all. So what we find is, though antisocial people reported feeling fear, which probably was the socially acceptable thing to report when watching a fearful slide, though they reported feeling fear, their brain scans indicated that they didn't feel the fear. So in other words, it looks like antisocial personality disorder people don't experience fear the way the rest of us do. So if you run into somebody, let's say in a public restaurant or something, you bump into somebody and they start to get in your face, saying something like, "What do you mean? What are you doing? Why are you running into me?" Well, you would think that it would be normal for someone to back down in a situation of confrontation like that. But a person with antisocial personality disorder is not likely to back down simply because their brain is not registering fear in the way that everybody else's registers. Next. Okay, we've talked about antisocial personality disorder. Now what we're going to do is back up and talk about personality disorders in general, and then we'll finish up by talking about several other types of personality disorder. Personality disorders in general account for 13% of the U.S. population, so it's fairly common. Now this is not all antisocial personality disorder. There are various other types of personality disorders as well. But overall, it's estimated that about 13% of people walking around out there have some sort of personality disorder. In the case of personality disorders, what we're talking about is a disorder in which the person's personality is what causes them distress or causes distress to the people around them, impairs their functioning, and is consistently deviant. Oftentimes, if you read about personality disorders, you'll come across these next two words, pervasive and enduring. Personality disorders are pervasive. That means that they influence all areas of the person's life. We sort of got that picture already when we talked about antisocial personality disorder. Pervasive means that pretty much every area, work, school, relationships, parenting, family interactions, everything is going to be influenced by the personality disorder. Enduring means lasting over time. Personality disorders, there's evidence usually of them starting early on in life and lasting throughout the lifespan. So for example, someone with antisocial personality disorder isn't likely to outgrow it. However, most antisocial personality disorder people do tend to mellow out somewhat by the time they reach their 50s, either because if they last that long, oftentimes they die before that, or they're incarcerated before that for life. But if they last that long out of prison, that does tend to mellow a bit, but still they're much more antisocial than everybody else throughout their entire lifespan. Finally, personality disorders are difficult to treat. Can you imagine why it would be difficult to treat a personality disorder? Well, the symptoms here are the self. Can you imagine if the symptom was not something like your mood or anxiety, but the symptom was actually yourself and who you are? To treat a personality disorder means to completely change or reorient a person's personality, a very difficult task indeed. Let's go on and look at some other personality disorders. Next. Besides antisocial, another brand or another category of personality disorder is dependent personality disorder. I can recall a bright 18-year-old female freshman college student who came from a small rural town. She and her boyfriend both came from the hometown, and they continued to date when they came to college. She wanted to take all the same classes as him. She wanted to spend all of her free time with him. She relied on him to take her to get things for her from the store, to help her decide what classes she would take. She wouldn't go to the dorm cafeteria without him. She wouldn't go out anywhere without him. At first he was kind of flattered by all this attention, but after a while he became tired of it and kind of felt like she was clingy. Turns out what this young lady was experiencing was what's called dependent personality disorder. People with dependent personality disorder are people who need excessive advice and reassurance. They may want to know, it's reasonable to want to know advice from other people, but they want more than the usual amount of advice. So let's say, for example, that I needed to get a new cell phone. So I asked my wife what her opinion was, and I called my parents and asked their opinion, and then I called my mother and father-in-law and asked their opinion as well, and I called my brother and asked his opinion, and my sister and asked her opinion. Then I began to ask all of my students their opinions as well, as what kind of cell phone should I get. Well, it's one thing to ask advice, but it's another thing to need excessive advice like that. And people with with dependent personality disorder need this kind of excessive advice. They have difficulty making everyday decisions without having this kind of reassurance or advice. They also tend to look to others to take responsibility for their life, for their daily life. For example, I had a student come in a few years ago to my office at McMurray, and this student was in for an advising appointment, needed to know what classes to take. She came in and she brought a friend with her, and my advisee sat silent through the entire appointment while her friend negotiated what it was that my advisee should take. And at the end, then my advisee signed the advising agreement and registered for classes. However, she didn't have any part in the planning. She really wanted her friend to take responsibility for her, and her friend did take responsibility. It was kind of a strange situation. People with dependent personality disorder also have trouble disagreeing with other people. Why? Well, if you disagree with other people, you may lose their approval. And if you lose their approval, they may leave you, or not want to be friends with you, or not want to be boyfriend or girlfriend with you. So disagreeing is a difficult thing to do because of fear of being abandoned. We see a low self-confidence in people with dependent personality disorder. They may have difficulty starting projects. Maybe there are goals or dreams they have in life, but they've never approached them or tried them because of low self-confidence. Finally, people with dependent personality disorder tend to be uncomfortable when they're by themselves and feel helpless when they're by themselves. So you can imagine that when a person with DPD is broken up with, loses a dating relationship, that they probably rebound quite quickly. Next slide. Here's another type of personality disorder, schizoid personality disorder. Not the same as schizophrenia, a very different name than a very different type of disorder than schizophrenia. There was a young couple who were kind of in their about in their mid-20s that I saw at one point as a therapist. They came in with relationship problems. The husband had scheduled the appointment, which is somewhat unusual. Usually when I see couples, it's the wife that schedules the appointment, not the husband. But the husband had scheduled the appointment in this case. They came to therapy, and she said she didn't want to continue the marriage. He wanted to continue, she didn't. Well, I asked about all the typical things you would expect in a situation where somebody doesn't want to continue a marriage. There hadn't been any lying or deception. There had been no affairs or cheating. There wasn't, neither of them had fallen in love with anybody else. She wasn't depressed. In fact, she barely felt any sadness at all over the prospect of ending the marriage. And as I questioned her, I began to understand that she didn't want the marriage because she didn't want to be married at all. She didn't want any kind of relationships with other people. She said the only reason she had gotten into the marriage to begin with was because her parents had pressured her so hard to do so, that she knew that that's what people tend to do, that she finally gave in and married him. However, she always felt like she was kind of being dishonest because she never really wanted to be with him. And when asked what she thought her future might be like, well, she was in a hard science. She was a graduate student, one of the hard sciences, chemistry or physics, I think. And she just wanted to work in a lab. She just didn't really want to have anything to do with people at all. Turns out what she had is called schizoid personality disorder. Maybe our most common language word that would fit with this is the word hermit. People with schizoid personality disorder tend to be kind of like hermits. They don't desire or enjoy relationships at all. Don't really even enjoy being part of a family. Maybe they don't even care about their siblings that much. They tend to choose solitary activities. They're not really shy. They don't have any conflict with other people. They just want to be on their own and be left alone. They also tend to show little, if any, interest in sexual experiences. Now, this is quite odd because almost everybody has interest in some sort of sexual matters. That's just part of the way that we're built. But people with schizoid PD are typically not interested in sexual experiences or don't find them pleasurable. They also tend to be indifferent to others' praise or criticism. So, do you like them? They don't care. Do you dislike them? They don't care. Do you tell them they're doing a good job? They don't care. Do you tell them they're not? They don't really care. They're just very indifferent and detached. Emotionally, you find them to be detached and cold as well. They may seem kind of aloof. They may kind of avoid other people and not have any desire to really connect with others. They may also act kind of odd, for example, staring at other people in a strange way, or others might find them very uncomfortable to be around because they're so emotionally detached and cold. Finally, people with schizoid PD tend to have very few social contacts other than close relatives. For example, the young lady that I was describing who wanted to divorce her husband didn't really have much social contact. She did have some contact with her parents, but she wasn't interested in much contact with them. However, they kind of pushed it. Now, in case you're thinking that this is shy, it really isn't. It's very different than being shy. People who are shy experience what we might call an approach avoidance conflict. That is, they have a desire to approach other people, to be with other people, but they also have a fear of being with other people, so they tend to avoid other people. The social phobia that we talked about in the anxiety disorder section is much closer to being shy than schizoid personality disorder is. They really don't have the desire to be with other people, whereas people who are shy tend to have a desire to be with others. They're just frightened to. Next. The last personality disorder we're going to talk about is borderline personality disorder. This is a very vivid personality disorder characterized by a lot of instability and intensity. On the left, you'll see a picture of Glenn Close. She portrayed a woman in the movie Fatal Attraction. The basic theme of Fatal Attraction was that this woman and this man meet while he's on a business trip, and they have a sexual affair, and then he wants to go back to his family, but she feels like he is basically her property now, and she ends up becoming extremely angry and agitated and stalking him. Now, that's a very dramatized version of borderline personality disorder in the movie Fatal Attraction, but people with this personality disorder can be very intense. I can recall, for example, a young man who presented at the clinic where I worked as being suicidal. In the intake interview, which was not with me, which was with someone else, he was very manipulative about whether or not he might kill himself. The therapist asked, will you make an agreement with me that you won't harm yourself while we get you some treatment? And he said, well, maybe I will, maybe I won't. And he was quite manipulative about whether or not he would harm himself. He reported having very few friends, people that were just generally were not really interested in being around him. He said that he was bisexual in his sexual orientation, and said that he dated probably 100 people, but no relationship lasted past 1 week in length. So, extremely unstable relationship pattern. He also said that he had an identical twin, and he's a student I ended up meeting with for a few times, and I asked him at one point what it was like to look at his identical twin, and his response to me was, looking at my twin is like looking in a broken mirror. He felt that badly about himself that looking at his twin was something that he found devastating. Some of the characteristics of borderline personality disorder are unstable emotions. People with borderline tend to be impulsive, intense, angry, and have unstable moods. So their moods might be all over the place. They might get angry very easily. They might also, in relationships, be very intense and jealous. And also impulsive, using substances or getting into sexual flings, things like that. In addition, people with borderline personality disorder, it's not uncommon for them to make recurrent threats of suicide and recurrent attempts at suicide. Also, you may find a person with borderline personality disorder tends to injure themselves, him or herself. Higher rate of prevalence of females than males have this. but they tend to injure themselves without an intent to commit suicide, so maybe burning or jabbing themselves. Oftentimes this is done in an attempt to try and control some of the intense emotions that go along with this personality disorder. Also, unstable relationships is a major feature of borderline personality disorder. You'll find a person with this disorder making frantic efforts to avoid being abandoned. For example, the young man that I mentioned just a few minutes ago, I had a contact with him on the phone before I'd ever even seen him for therapy. And in the contact I had with him, I mentioned to him that our clinic only did short-term therapy. That is, we saw clients for maybe 7 sessions or so. We didn't see clients for years and years. We were a short-term therapy unit. And he became intensely angry and very unhappy about this. Felt like he was being abandoned by me before I'd ever even seen him, because I said I couldn't see him for years of therapy. An example of frantic efforts to avoid being abandoned. People also with borderline tend to have unstable and intense relationships. Often you'll find this sort of push-pull thing going on with them. There is a person who wrote a book about borderline personality disorder, and the title of the book is I Hate You, Don't Leave Me, giving you kind of an idea of that intensity and instability. A person with borderline oftentimes will be intensely angry and hateful towards the person that they're in a relationship with, at the same time frantically trying to keep from that person from leaving. So the relationships end up being very unstable and intense. Finally, there's an unstable sense of self in people with borderline personality disorder, oftentimes feeling empty or feeling worthless or feeling like they have no identity. One of the things about borderline personality disorder is that it's very strongly related to the way that a child was treated, a person was treated during childhood. There doesn't seem to be much of a genetic component to this. There doesn't seem to be much nature. This seems to be almost completely a nurture effect. That is, it comes from the environment and the way the child was treated. And we find much higher rates of abuse and neglect as children in people with borderline personality disorder. Oftentimes this can involve physical and sexual abuse. Next slide. There are at least 6 other types of personality disorder, but for our purposes these are the 4 most interesting and the 4 most vivid ones that we've talked about. End of lecture.